To us, family-centered healthcare is really the only way to take care of children. Who knows a child better than their parent? We can't possibly deal with a child's illnesses or with a child's success without having the input of those parents and the rest of the family. Very commonly, there are siblings who are affected by a child's illness. There are other people who are involved in the care of this child, and we need to make sure that we have everyone involved as we offer care to children. We think that this is the most important aspect of all pediatric care. We have actually developed a system here which we call Touchpoints. Touchpoints is a system that Barry Brazelton, a developmental pediatrician who I think most everyone knows from Boston, he developed this system of talking with families, of really taking into account the whole family into the care of a child, and to do the interview in a developmentally appropriate way and in a developmentally appropriate manner. So the other part of this is communication, we know, is essential. And all too often, we start asking questions and we don't really listen for the answers. So we have our list of things we want to know, and we may forget to let the parents give us the questions that they have and tell us what they're concerned about. So the whole Touchpoints philosophy is, first of all, that you identify the strengths of the child, not just the illness and the weakness, but that you find the strengths in the child and the family, and that you communicate, that you find out what are people concerned about, what can we do to help them bring the child to their full potential, how can we work with them. So I can give you a list of 25 things I want you to do as a pediatrician. Watch out for this, that, or the other thing, safety things, this or that. But if you're sitting there trying to remember what it is you want to ask me, you're not going to hear anything I tell you. On the other hand, if I start by saying, what can I help you with today? And I get your questions answered at the beginning, well, then you're much more likely to be interested in what I have to communicate to you. So we really think that this is a two-way street, and that we really try to use the child as our reference and the interactions within a family to really make this family-centered care a reality.